don't normally post many videos of myself. I just don't like to see myself on camera or hear my voice, but occasionally it might be nice to just do a personal video. I do videos on Kallmann syndrome, which is the medical condition I have. I'm in my 50s now, but I was diagnosed with Kallmann syndrome when I was 23. Now, Kallmann syndrome is a hormone condition that prevents puberty from occurring correctly, and it means I have no sense of smell. And I was late diagnosis really at 23, but it can get picked up at all ages because it's not a very well known condition. So childhood was normal. So apart from my my poor hearing and my lack of sense of smell, so that was noticed in childhood, but nothing was made of it too much where I grew up. And so I wore a hearing aid occasionally, but sense of smell didn't really affect me very much. I didn't start puberty correctly at the right age. It was just assumed you were a late starter, late bloomer. I got sent to a doctor when I was about 16. They just said late bloomer, wait and see. Saw another doctor about 18. They just said wait and see, late bloomer. And not much was done about it really, because nobody asked me then about sense of smell and lack of hearing. Nobody linked that to puberty. They just said late bloomer. So I went to university, or I left school, university, still not started puberty, which was a bit strange at the time, but it wasn't bad. I just thought, okay, it'll happen one day, but okay. Went to university, after university, started my first job working as a biomedical scientist in a hospital in London, and I happened to see an endocrinologist in the hospital. And it wasn't an official appointment, I just met him in the corridor because I knew where he worked. And I studied endocrinology at university a little bit, so I knew the basics. And he asked me, did I have a sense of smell? And he was the first doctor to ever ask me that question. I can't remember if I've ever told doctors I couldn't smell. They said he didn't ask me, but I don't think I told them because I was so used to it. I know other people knew I couldn't smell because people went to school with at 6 or 7 that remember I can't smell, but I don't think I ever made a big fuss about it. And he asked, no sense of smell, and that led to some blood tests. So I did blood tests for testosterone and 2 hormones called LH and FSH. They were all very low, and that with anosmia, no sense of smell, confirmed the diagnosis of Kallmann syndrome. So from then, I was put on testosterone, and I've been on some form of testosterone or hormone treatment ever since. And testosterone doesn't, so you still do not get normal puberty even with the testosterone. It's because the problems in the hypothalamus gland in the brain, it doesn't take in testosterone at 19, 20, 21, and then when I was diagnosed at 23, did not start puberty. If I was a late bloomer, taking testosterone would have started puberty, but I'm not a late bloomer. It is a different condition, Kallmann syndrome, and there's another name for it is hypogonadotropic hypogonadism, which I'm not going to say out loud too often, it's a HH, but that's the overall name of the condition. And so that taking testosterone then gives me like a bit more body mass, a bit more hair growth, sex drive, voice breaking, hair, loss of hair, like losing hair on top. So all the normal changes seen in puberty, apart from the fertility bit, were corrected taking testosterone. And I would have to take other hormone treatment called gonadotropin therapy if I wanted to become fertile. And I have been on that twice as part of clinical trials, but I'm trying to get on that again, but it's not always easy to get a hold of. So normally I just take testosterone in some form. And there are many different ways of taking testosterone, either gel, monthly injections, weekly injections, tablets, capsules, or I have 3 monthly injection called libido. So I first met the first fellow patient when I was at the Royal Free Hospital, when I was about a year after I was diagnosed, and ever since then I've been meeting fellow patients, talking to them online, and just trying to get as much information about the condition as possible. So I talk to doctors, and I go to read medical papers, go to meetings, then I help try and present that information to fellow patients. So most of the time I spend on the internet, either writing or talking about Kallmann syndrome with fellow patients, just try and raise awareness of the rare condition. And I like meeting fellow patients. I think it helps me. I think hopefully it helps them sometimes, because it's quite a wide-ranging condition. So it has different other symptoms. So it's nice, and because it's so rare, people don't meet other patients with the condition very often. So it's nice to be able to talk to another patient sometimes. As it happens, with the school I went to, had another KS patient there 2 years after I left. I didn't know that about 10 years ago, and we just met online, and just happened to be he lives in the same town and went to the same school, which is a bit of a coincidence, but it's usually very rare, and you can get treated by a doctor who's never heard of the condition before, so it's sometimes difficult to get information on the condition. And it comes in different severities. You can get no puberty at all, or you get minor, half puberty or incomplete puberty, and you still need treatment. So it's not like an all or nothing condition. So you get degrees of severity, and you get extra symptoms like the lack of sense of smell, hearing, you got fused fingers, missing kidneys, missing teeth, cleft lip. Not everybody has the same symptoms. It does because it has a wide genetic cause. So everybody's got slightly different symptoms, different severities. Even brothers would have different severities. So it's sometimes quite difficult to diagnose because it's seen as being a late bloomer, and sometimes doctors don't know about the condition, so they just get told, I'll go away and wait and see. So from 20 to about now, I've just been talking to people about condition. I like attending meetings. I talk to doctors a lot. I'm attending an endocrine conference in Boston later this year, to present a poster on the condition. So that's about it, really. I like to talk. So it has to be on lifelong treatment. It affects men and women. It's more commonly diagnosed in men than women because it's often misdiagnosed in females, and causes infertility is treatable, but it's also going to be passed on to the next generation. So if you get fertility treatment, which can take about 2 years for males to work, there's still a chance of passing it on, but it's very difficult to predict the chances of passing on because the genetics of Kallmann syndrome is so complicated. So there's not really much chance of predicting it. But fertility treatments are available, but they are short-term acting, so you only take it for about a couple of years, then you stop and you go back to being infertile. The physical symptoms can be treated by testosterone or the women estrogen and progesterone, but the psychological and psychosexual aspects of the condition are different, and they're more difficult to get into a video. But I talk to them with fellow patients, and I'm happy to talk about that with people one-to-one, but it's very difficult to say that in the video. But it does affect emotional and physical relationships, and affects different people in different ways. So it's very difficult to say, if you have Kallmann syndrome, you have this, because everybody's slightly different. But that's why patient groups and talking to fellow patients does help, because it's not a good condition to have. It's not the worst condition, because otherwise you are healthy, but it can affect you emotionally because you miss out on puberty and adolescence. So that's a big part of growing up. When you're a teenager, you miss out on these development stages of teenager. So sometimes you don't quite fit in. Some patients fit in quite well. They take the testosterone and they're more happy because there's no other complications with the condition. But other patients can struggle if they miss out on puberty and adolescence to fit in socially, and that can be a problem sometimes. So it's a little bit more needs to be done about that. I think I've just come up to 10. I think I've spoken enough. I'm very happy to talk about Kallmann syndrome and development and the fertility side with us, but it's sometimes easier on one-to-one discussion. I'll try and put some subtitles if I think I've heard enough of my voice. Okay, thank you then. Bye-bye.